Well, the outbreak in West Texas comes as North and South Carolina both are seeing slight declines in recent years, specifically in children starting kindergarten who are now up to date on their measles vaccines. Queen City News anchor Robin Kennedy joining us live now from West Charlotte. And Robin, why do health officials say they're now seeing this drop in school children getting their shots?
Yeah, Alicia, health officials say some of the reasons, and one of them that some parents might not be getting their kids vaccinated is because of scheduling and concerns about cost. But another reason is something we've heard more about in recent years since COVID. Lower percentages of North and South Carolina kindergartners are getting their measles vaccine than in years past. North Carolina is at a 4-year low, with 93.8% of kindergartners getting the measles, mumps, and rubella vaccine in the 23-24 school year. South Carolina is at a 10-year low at 92.1% of kindergartners getting the MMR shot in the 2023-24 school year.
It's definitely concerning because remember, we're talking about hundreds of thousands of kids in that number, right? So even small percentage changes could impact our ability to be able to protect our kids from these infections that we know are preventable with vaccination.
Dr. Raynard Washington, Mecklenburg County's public health director, says there are two reasons some parents aren't getting their kids vaccinated. One is access, and the other is resistance.
We are seeing more vaccine hesitancy in our community, in some pockets of the community. So we know that there are some groups, some communities, some religious groups as well, who oppose vaccines for their children.
In West Texas, where an unvaccinated child died from measles, the health department says one of the areas where the virus has spread is in a close-knit, under-vaccinated Mennonite community.
What's happening right now in West Texas is very heartbreaking. It's preventable.
In North Carolina, since 2020, there has been a rise in religious exemptions, which are higher than the number of medical exemptions for school students not getting vaccinations of all types.
We are where we are with measles because of the vaccine itself, right? And so I think that is a fact that's true. If it were not for vaccines, we certainly be dealing with these kinds of measles outbreaks on a much more frequent basis.
Now, children without insurance can still get their vaccinations at little or no cost through the Vaccines for Children program. Live in Mecklenburg County, Robin Kennedy, Queen City News.